For the next 20 minutes, I'll be talking to you about some of the work that we've been doing, and I'm approaching it from the perspective of the end user, because in our side, we have to take this type of guidance or systemic reviews, and we have to put it into practice. And if you start to think like we have to think, it might help you in designing your experiments, and it would also in the interpretation of the results. Now, before I begin, though, I do work for the Department of Defense, so I have a disclaimer, and that is anything I say is not a policy of the United States or not their opinion, it's mine. And if I show brand names or call them out, it's not an endorsement by the Department of Defense, and I have to tell you I am going to do that today. They are not the endorsement of the Department of Defense. I wanted to give you my take-home points up front. In our world, think about food as a solution, not supplements. In terms of your own research, consider the meaningfulness of your results. It's one thing to have a statistical outcome, to say I've found something statistically, but is it meaningful? Is it large enough in its effect magnitude that you would want to change practice? If you think it is, ask yourself, are my results translatable? And if they're not, what other information do you need to know to make them translatable? So for the rest of my talk, I'm going to go through the following outline. I'm first going to briefly discuss why evidence-based reviews are important to us. I'm then going to take a little bit of time to orient you to field feeding and nutritional feeding within the military. And then I'm going to spend the rest of the time with three, what I'll call exemplars, 3 different projects that we've been doing that deal with fatty acids. And I'm doing them not to so much brag about what we're doing, but I think that they can be examples for making the point about that might be informative for you in thinking about how you do what you do. Now, where systematic reviews come into play, your data that we collect, they go into the systematic reviews, and then organizations like the IOM will use those to make decisions and formulate documents such as the DRIs. In the military side, we look at systematic reviews, but we rely heavily on documents such as the DRIs, and then we in turn interpret or take those and we translate them into our population. And in the case of the military, we have military-specific DRIs. But that's not the end of the story for us. We then take those and we translate those into working documents that inform people how to set up the dining hall so that the soldiers eating there have the actual opportunity to meet those DRIs. Now, where we don't have enough evidence, you have to do additional research. And one thing you need to know about the nutritional research program is that it's always solution-oriented. And it's also military relevant. So if you want to come and work with us, you have to think in that mindset. Now, the overarching goal here for us is to provide the nutrients that would not only fuel the soldiers so they can do the activities, but we're thinking about the nutrition in the standpoint of enabling them to be all they can be day after day, regardless of the extremes that we're putting them in. But one underlying thing we always have to keep in our mind is on the last line on the slide, and that is, it's not nutrition unless it's eaten. So we can have great ideas, but if it's not going to be in a package that they can eat and taste the way they want it to taste, we really haven't accomplished the goal. Now, the nutrition research program, we target the places that a soldier eats, but more specifically, the areas that we can manipulate. Majority of soldiers eat in the home environment, so that's a little harder for us to deal with. But we can manipulate the dining hall, and we can manipulate the rations that they're eating. Now, one thing you need to know about operational rations, the cornerstone ration is the meal ready to eat, or the MRE. It is where they would rely on when they don't have access to garrison-type feeding. 2 things to really know about that ration is that it's a forward deployed ration, which means that once it's manufactured, it's put in its box, and then it's stored somewhere until the user needs to have it to consume. it has to have a shelf life then of 3 years. That's 3 years at 80 degrees Fahrenheit. That criteria alone narrows what you can do, what type of foods that you can put in it. The other is that it's a cost-constrained ration, which means that if you have a good new idea, either as an ingredient or a component, in order for that to be inserted, something else has to come out. Well, that means you have to have a good, solid evidence base to make that adjustment. The other thing about when soldiers go out in the field and they're eating these rations is that they typically undereat. And a large reason for that is that they eat as time permits. Well, that means you have to start thinking the way that they're operating. You have to think about how you're packaging it, and is it something that they're going to want to eat when they have the opportunity to eat. Now, our interest in fatty acids really kind of perked with the most recent conflicts and the observation, if you want to call it, that a number of soldiers were having trouble on the mental health side. And this slide just illustrates the increase in PTSD, or post-traumatic stress disorder, that occurred over time. And around 2009 or so, there was a conference that was held, and that kind of got into this idea of maybe you should be thinking about the HUFA status of the soldiers, and maybe that might be contributing to part of the problem, or it might be part of the solution. And one of the guidance that came out of that is that it might be a good idea for the soldiers to eat a diet with less N6 and consume more N3. And so that's nice, but how would you go about doing it? Well, for the rest of the talk, I want to share 3 activities that we've been engaged in that's kind of tried to address that. How could we put fatty acids into their diet and using a food-based approach? And where I want to start off with is the operational ration in the MRE. And what I will tell you up front is that historically they've had they're very, very low in N3, and that's largely because N3s are so readily oxidized, and so they'll start to taste. But is there now technology available to do that? And the answer may be in that it's the development of the encapsulation technologies. The Combat Feeding Directorate, the people who developed the MRE, were able to acquire some encapsulated N3s products from the commercial industry. So the first thing they wanted to know is if they inserted them into a bread product or a meat product, would they be able to pass shelf stability tests? The answer to that is yes. They then used those products and they ran a taste panel to see if people would notice the taste not only when they were fresh, but after they had been stored. And the answer is that they still had acceptable taste. So another good plus. But then the question is, well, after you've stored them, is that micelle, is it basically just go out in your feces, or are the fatty acids actually able to be absorbed? So the graph on the right-hand side just shows data of a trial we did, was like a glucose tolerance test to say, do we see a pulse of the fatty acids in the bloodstream after the products have been consumed, and has it changed after these products have been stored for 6 months in a hot temperature? And the answer is that it didn't have any impact. So it appears that we could fortify the certain components of the MRE with EPA and DHA, and they would be bioavailable and probably products that would be acceptable. So there's a solution if we were to decide to adopt them into the rations. Now, the second project I wanted to talk about is a dietary intervention approach. The overarching goal was there a way that we could take an American diet? Could we lower the omega-6 fatty acid content? Could we raise the omega-3 content? And would we be able to produce large changes in their tissue fatty acid composition? So for the next few minutes, I want to share with you that project. The project was actually done by a large team from a number of different organizations. I want to call out 2 people in particular. So one is Dr. Joe Hiblin, and I'm calling him out because the way we did this is really his idea. Second one I want to call out is Michael Hawes, and he's in the commercial industry. If you're in the right part of the country, you might see his product. It's the Christopher egg. It's a high omega-3 egg. Now, why I'm calling him out is that without his help in his knowledge of the commercial food industry, we probably couldn't have gotten this done, and we certainly couldn't have got it done at the cost that we did. The foods that we were able to build menus that would be changed in the fatty acid composition were really only possible without a large number of different people contributing and many times in kind support. And so on the left-hand side, I'm just showing you some of the different companies that were very kind enough to help us. And on the right-hand side, the different products and how they provided us support. Now, the general approach that we used was to take advantage of a soybean that DuPont Industries had developed, which is the Plenish soybean. And this is a soybean that's really a high oleic acid soybean. And we used it as the base feed for chickens. And in doing so, we could produce eggs that would have a lower 6 and a much higher omega-3 content than a traditional egg. We did the same with broiler chickens to change their tissue composition. We ran taste panels to make sure that people really would notice what we had done, and we found a recipe to feed the chickens that would work. And then we went to the food industry, different companies that made chicken products to kind of diversify the menu or the things that we could do with this experimental chicken. The oils from that Plenish oil have also been used in some commercial products, and so we incorporated those. And so we had dressings, spreads, and sauces, as well as peanut butter that was essentially N6, or really low in N6, but also had higher N3. Now for the experiment, we then ran a trial which I'll show a little bit more on the next slide, but I think this slide helps us to understand what we manipulated. The foods I have in the picture are going to be what we're going to insert into the food supply or the menus that the participants are going to feed. So there's 3 arms to the study. There's a control group who that ate a 7-day menu of a Marine Corps diet, or a 7-day menu, yeah, that's right, we'll just say it. And the control group had the traditional eggs, traditional chickens, traditional dressings. And then we also provided them a smoothie drink that was a placebo smoothie. So that's one arm. The first experimental arm had the same menu, but we substituted in our eggs, our chicken meats, and our dressings. And they also received the placebo smoothie. So that gives us the ability to answer the question, if we just change the diet, how far could we move their fatty acid status? The third arm got the same treatment as the experimental arm. These foods were substituted, but that smoothie was then fortified with N3. So that gives us the opportunity to say, how far could we push this if we really, if we not only changed food, but we added the food supplement? The actual trial was done at Pennington Biomedical Research Center. It was a 10-week dietary intervention. So there are foods that we provided, that their staff in the kitchens would then make the menus. The participants would come to the Pennington to eat the food. And the pictures just give us some illustration that these are regular foods that they're getting. We're just substituting our specific items in, and they're just being plugged into these standard menus that they're eating. This slide I'm trying to make 2 points. One is that our diet was really pretty darn effective. And if you look at the top part of the slide, the total N6, the control diet, if you look at a 2,000 calorie menu, had about 22, 23 grams of total N6 in it. The experimental foods dropped it down to 8. So about a 64% lower total N6. The N3s went from 0.2 grams up to 0.9 in the experimental food only, so about 440% increase. And so the N6 to N3 dropped quite remarkably. It did work. The blood status on the left-hand side is the N6% that's in HUFA. If you So at the beginning, they're quite poor. They're about 80% N6. That persists in our control group over time. Here's the experimental group, just the diet alone. They dropped into the low 60s. If we also add that placebo or that smoothie that had the N3, it dropped into the mid 50s. So essentially they're eating an American diet, but we've dropped them to look like they're eating a Mediterranean diet. On the N3 index that Bill Harris just talked about, they started in the 3s. With the experimental diet alone, they were nearly 6. And when we had that smoothie, we got them into the 7, 7.5 range. So it was pretty effective. But like I said, I'm not doing it so much to say that we were remarkable, but think about how the things that we're having to think about in terms of trying to build something that we could actually put into practice. There's 2 talks here at Experimental Biology that go into this a bit more. The top one is actually a presentation that's on Tuesday that will go more into what we did with the effect of our diet on the fatty acid status. The second one, the bottom one, is a poster I have tomorrow that goes at a sub-experiment that we had built in to say, well, okay, now that we changed them, what would happen? Or how did it have any remarkable effect on the individuals? The last exemplar I want to talk about is a follow-on to that. Because once we've done that, now we say we have these foods. If we could force people to eat them, it would have an impact. But in operational, people have ad libitum choice. So we put these into a dining hall. The question we're asking now is, if we put them in a dining hall, would people eat them frequently enough and in enough quantity that would actually have a meaningful effect? Because with that kind of information, we could start to ask, well, this is the benefit that we can produce, and we can look at the benefit to cost ratio. And that way we can make an informed decision as to whether if we decide that we need to do this, from a health standpoint, we say we should change the fatty acid status, and we have a way to do it, but is the cost to the benefit worth it? So just as a summary, so what I hope I've done over the last few minutes is help you realize that we're very much a problem-driven, solution-oriented approach. And hopefully that kind of informs you in a way of thinking as you're designing your experiments. And hopefully makes it clear to you that we really do need a solid set of evidence so that to inform us when we go through decision-making process. And I use this omega-3 today just as an exemplar of that sort of way of thinking. So thank you very much.